Broadcasting Corporation in Freetown. Good evening and a warm welcome to News Hour. My name is Mahawa Leone and thank you very much for joining us. Coming up in this edition of the news, as Parliament approves the 2019 budget, members of Parliament advocate to increase budget of the SLBC. Female genital mutilation public campaign intensifies, and Marriage Stop Sierra Leone introduces emergency family planning contraceptive. Well, all these stories and more, including business and sport news, lined up in this edition of the news. And for our first story this evening, as Parliament unanimously approved the 2019 budget, members of Parliament have resoundingly advocated to increase the budget allocation for the SLBC, saying that the SLBC is the state broadcaster. Well, the budget was approved after committees of supplies presented their findings and recommendations to the Ministry of Finance for some increment in certain ministries, departments and agencies on their relevant roles to the country's national development. Ibrahim Samura report.
The bill entitled the Appropriation Act 2019 be read the third time and passed into law.
Honorable members, the question is that the bill be read the third time and passed into law. All those in favor say aye. Aye. All those against say nay. The ayes have it.
This approval has given the government of President's bill to authorize expenditure from the Consolidated Fund for the services of Sierra Leone for the year 2019 and for other related matters. The budget was approved after the committees of supplies scrutinized the budgets of the different ministries, departments and agencies of the year 2017, 2018 and 2019 budgets. Various committees presented the findings and recommendations. Among the findings were late disbursement of allocations to MDAs, no supported document on the expenditures and salary disparities of some public servants, among others. The committees in their recommendations said some MDAs allocations are to be increased, especially the SLBC. Ministries of Agriculture, Labor and the Security sector, saying that these are strategic institutions to peace, security and socio-economic development of the country. Dr. Patricia Lovely is the Deputy Minister of Finance. In response to these concerns, assured parliamentarians that a ministry had taken note of the concerns.
Approval of the 2019 Appropriation Act today signifies that the new direction agenda is ready. Under His Excellency of President Julius Maada Bio, yes, he has been in governance, we have been in governance over the last 7 to 8 months now. Now, what we have done in Parliament today with the ratification of the 2019 Appropriation Act is to demonstrate what we as a new government is ready to deliver for the people of Sierra Leone. Not only have we increased the allocation, we have listened. Of course, we do need to increase the allocation to SLBC, but we can only do so incrementally.
She lauded them for approving the 2019 budget and will authorize expenditures from the Consolidated Fund for the services of the country for the 2019 financial year. Leader of Government Business, Honorable Mohamed Sidi Tunis, commended colleague honorable members for the healthy debate on the Appropriation Act 2019, saying that the budget was passed on time.
The team from Ministry of Finance, but more especially the Deputy Minister of Finance. I want to also thank the Minister of I want to also thank the MDAs. Without the MDAs, we will definitely not be able to do our jobs. Mr. Chairman, honorable members, and our guests, Fourth Estate, this is the first time in many years that we are going to pass the national budget on time. For the first time, we must congratulate ourselves. For the first time, we are having the financial strategy statement, the Finance Act, the government budget and statement, recurrent and development expenditure estimates, everything on time and in line with the 1991 Constitution. For the first time in several years.
Honorable Hassan Sise is the acting leader of the opposition APC.
With the figures quoted here, Mr. Chairman, I'm sorry to say that whoever advised along this line is not doing a good job for our country. And I'll say why, Mr. Speaker, Mr. Chairman, sorry. These figures, now they are asking for more. If we consider that we spent over $100 million just to import rice, if we can increase productivity at local level, definitely we will cut that amount of money and direct those resources to other more beneficial social services for our country and our people.
Parliament also approved 4 presidential nominees to serve as Director General and board members. They are Victor Lansana Krumah, Member Board of Trustees SLBC, Lawyer Junisa Patri Bangali, Director General Water Resources Management Agency, Sheikh Aliu Suaridin, Board Member NATCOM, and Madam Edna Jones, Board Member Tertiary Education Commission. Ibrahim Samura, Freetown.
Now, female genital mutilation is a practice that is done in secret society, commonly called Bondo in Sierra Leone. Well, this has been regularly performed since before independence and as a cultural institution and has been a major role in West Africa. But the practice has received public condemnation as having negative effect on the health of women and initiate. Well, the Forum Against Harmful Practices, FAPT, has embarked on a nationwide public education on the practice, especially for young girls. The campaign started here in Freetown. Our reporter, Julian Lumbuya, filed on this report read in our studios by Wilhelmina Buko.
Reduction of female genital mutilation in Sierra Leone has started a massive education on FGM in the country as a whole, especially for young girls. According to Salimatu Kamara, Regional Coordinator, North of the Ministry of Political and Public Affairs and member of FAP, representing Tamarane, FGM is a major problem in Sierra Leone. She said they usually train school children so that they will in turn educate their peers. The Ministry of Social Welfare, Gender and Children's Affairs, Goody Sunis, said the procedure is usually performed by an elderly woman of the village. In her days, they used to look at the girl's breast properly and make sure she is of the right age before putting her into the Bondo society. But now, even young babies are initiated. She cited that early marriage is another challenge for the underage girls. Female genital mutilation can even cause HIV and other transmitted diseases as they use the same blade on all the girls that they are initiating. Many women lose interest in sex as that can cause more danger to their marriages. Olabi Balkanda is a researcher who is doing her research on female genital mutilation. According to her, there are different types, but the one that is commonly practiced in Sierra Leone is type 1. Time spent in the Bondo bush for initiation into womanhood used to take about a month, but has been significantly reduced. Members of the Bondo society have higher standing than other women. The cost of initiation into the Bondo society is quite expensive, and parents feel proud when their daughters are initiated because it shows they are financially stable and able to afford the cost. Millions of girls in Africa undergo female genital mutilation every single year, and Sierra Leone is one of those countries where the prevalence rate is over 90%. SLBC News, Willimina Buku reporting.
Now, Maristop Sierra Leone has introduced an emergency family planning contraceptive known as backup. Well, the medication prevents pregnancy after unprotected sex by delaying ovulation or preventing fertilization of eggs. Dr. Ofoma Festus Omo Obis is the country director of Maristop Sierra Leone. He explained more during an introduction of the contraceptive at a press conference.
Your backup plan, and we normally will say in Maristop Sierra Leone that any plan you have without a backup plan is not a plan. You have to have a plan B, and your plan B is backup. The medication is believed to prevent pregnancy primarily by delaying ovulation or preventing the fertilization of egg. It also prevents implantation of the egg by altering the walls of the uterus. It's important to realize that once implantation has occurred and pregnancy is established, levodopa cannot cause an abortion or harm the fetus. And no serious medical complications have been reported with this medication. This medication backup, which is this, which will be presented to the whole of Sierra Leone tomorrow, which is already available in drugstores and pharmacies and patent stores nationwide, reduces the risk of pregnancy among users from 8% to around 1% after unprotected sexual intercourse. That means it is very efficacious. It's most effective within the first 24 hours. So if you know you need backup, why delay until the second day or the third day? That's when you can't have access to it. That's why we said any plan you have, you must have a backup plan. So if you know that you are going to be having sex, just keep backup in your bag. Just the same way people plan and have condoms, have a backup plan. Buy backup. You don't know when you need it. It should be noted that this medication, backup, does not prevent sexually transmitted infections, including HIV/AIDS. Right? It doesn't prevent the transmission of gonorrhea, syphilis, chancroids, and all of the STI families that you know. HIV. And especially the big masquerade, people will say HIV is because it does not have a known cure. The 1.5 tablets contained in this kit is just one tablet. Usually some emergency contraception will have 2 tablets. And they will tell you take the second tablet within 6 hours. This one is like no story. Anytime you take it within the first 24 hours, you don't need to bother where to look for where is the second tablet, right?
The Sierra Leone Social Aid Volunteers and the Christian Aid has ended Citizens-led Accountability Governance Service Summit under the SABI project in the northern region. Well, according to the country director of Sierra Leone Social Aid Volunteers, Alfred Jata Dumbuya, the project will end in 2020 and that Sierra Leone will have an improved service delivery system. Yvette Goldsmith report.
SABI is a citizen-led accountability governance program funded by UK Aid through Christian Aid with consortium of partners to address development. The aim is to support citizens to engage with state service providers to identify issues and accessing quality service in education, health and social protection. The team leader for the Sabi project, Amanda Bangura, says the Sabi project serves as a liaison between citizens, state service providers in addressing challenges. She noted that the project is a citizen perception survey in 610 communities within the 16 districts of the country.
What we're seeing is that there's a challenge between bringing these two groups together to discuss and identify issues. So it's difficult for government to respond if they don't know what citizens are experiencing, and it's difficult for citizens to engage with the government if they don't know who they can speak to and how they can escalate their concerns. So Sabi is trying to bridge that gap and bring people together so that together they can find solutions.
Team leader Sabi Project said some of the key findings include limited access to antenatal care by women due to the long-distance location of PHUs, limited school furniture, adding that government is ready to address the findings identified in the Sabi survey.
Related to the challenges that pregnant women are facing in accessing antenatal care, and primarily those are arising because they're saying the PHUs are quite far away, and they're particularly in the rural areas, they're challenging finding transport and funds to pay for transport to access them. We've also spoken to head teachers, for example, who have talked about the limitations in their capacity to enroll students because of the lack of furniture.
The country director Sierra Leone Social Aid Volunteers, Alfred Jata Dumbuya, said the project started in 2016 and will end in 2020 with the expectations that Sierra Leone would have an improved service delivery. He added that strengthening accountability is a focus of the Sabi project, with a focus on service delivery and targeting the northern region. Some of the key challenges identified by stakeholders at the Service Summit in the area of education include limited school feeding program and unapproved teachers. On health, they capture the long distance of PHUs for pregnant women and people with disability to access free health care, and unemployment for people with disability. An action plan was developed to ensure that residents in the northern region access quality service delivery come 2020, which is the end of the Sabi project.
Our Director General of the National HIV and AIDS Secretariat, Alhaji Dr. Momodu Sise, has officially opened the first delegate conference of the network of HIV persons on the theme Building a Resilient Network. While NEPSIS is an umbrella body of people living with HIV that is geared towards, among other things, ensuring that its members has access to quality treatment. Joseph Stanley reports.
Dilating on the theme Building a Resilience Network, Dr. Sise said NEPSIS has shown resilience over the years by being focused and proactive and breaking through the barriers to survive when HIV testing was considered a death sentence. He described the theme as appropriate, noting that resilience means being able to adapt to life's misfortune and setbacks. The Director General welcomed the transformation approach NEPSIS is planning to do, as it will give a human face and voice to HIV and will create an impact on the national response. He stressed the need for community intervention to take services to the people and commended NEPSIS for supporting the national AIDS response by monitoring HIV services through its membership. He appreciated the bold step taken by NEPSIS in moving with the changing times and pledged NAS's commitment to ensure they collectively achieve the objective of making HIV a non-public health threat by 2020 and ending AIDS by 2030. According to the Executive Director of NEPSIS,
the Sierra Leone Alcohol Policy Alliance has expressed its support to the Sierra Leone Police in its drive to ensure that the festive season is observed in peace and safety. According to the chairman of the Alliance, Ibrahim Kamara, the organization is advocating for a policy to regulate the production, sales and marketing of alcohol in Sierra Leone. Yvette Goldsmith report.
The Sierra Leone Alcohol Policy Alliance, SLAPA, acknowledged the efforts of the Sierra Leone Police in maintaining safety and security during the festive season. The alliance supports bars to be closed down at 11 p.m. and that it is unlawful for anyone to drive while under the influence of alcohol. A research conducted in September 2018 by the Sierra Leone police revealed that 40% of road traffic deaths in Sierra Leone are alcohol-related. World Health Organization Global Report on Road Safety 2015 indicates that Sierra Leone's death rate in traffic accidents was worse than the African regional average, the highest of all regions in the world. Chairman Slapper and Forut Ibrahim Kamara commended the efforts of the police and called on them to enforce the laws at all times, and urged the government to develop a national alcohol policy and a comprehensive review of the Liquor Act. He said measures like strengthening their restriction on alcohol availability, establishing and enforcing laws on minimum drinking age, among many more, should be instituted.
Commending the effort of the Sierra Leone police in ensuring public safety and security during the festive season, SLAPA notes the importance of enforcing these laws of all times. Urges government that they should not be limited to the festive season alone.
Executive board members also stressed that SAPA vision for a peaceful, healthy and prosperous society where Sierra Leoneans enjoy their lives in dignity and prosperity. He said alcohol and drugs should not prevent people from fulfilling their full potential.
This is the time we have to have our voice, our advocacy voice, and we encourage the media also to play their own part. And we'll see that at the end of the festive season, the rate of alcohol abuse will reduce after our activities.
Now, the Director General of the National HIV and AIDS Secretariat, Dr. Momodu Sise, has said that HIV prevalence has dropped among pregnant women, but the mother-to-child transmission rate is still high. He made these statements during a news conference on preliminary findings of the midterm review of the National Strategic Plan and other documents of the National HIV and AIDS Secretariat. Joseph Stanley reports.
According to statistics from the Secretariat, an estimated 61,000 people are infected with the virus, of which only 47% of them have known their status. The Director General of NAS said 43% of those tested positive are on treatment, and there is decrease in new infection, but an increase in positive rate. He informed media practitioners that NAS commissioned review of the 2016-2020 National Strategic Plan to assess the relevance, effectiveness, efficiency, sustainability, good practices, as well as identify priorities. Key findings, Alhaji Dr. Sise said, men are more affected than women. High burden district increased from 7 to 9 districts, and positive rate among children is reducing, but the progress is slow.
In 2010, we did a study for pregnant women who attend antenatal clinic. We were at 3.2%. We've just finished one. The results are out. We are now at 2.8%. So it has dropped, you see, from 3.2 to 2.8%. However, what we are not too satisfied with is, even though that has dropped, okay, but we still see the mother-to-child transmission is still not reduced as we would want it to be.
He added that country coverage of HIV services is low, gaps in mass media communication to create awareness, response is donor-driven, and challenges with procurement and supply chain. He said inadequate resources to increase the number of service delivery sites, stigma and discrimination is still high. High defaulter rate, and policies and laws related to HIV and AIDS do not stand the test of time are some of the challenges faced by the Secretariat. On the just concluded World AIDS Day, Dr. Sise said, among others, over 33,000 adolescents and young adults were tested, and the positive rate is 1.6%.
News are on the Sierra Leone Broadcasting Corporation in Freetown. We continue with more stories making news this evening. The Ministry of Mines and Mineral Resources has briefed journalists on recent development in the mining sector. Among other things discussed is the countrywide survey, which started in October this year, aimed at providing geophysics data to provide vital new insight into Sierra Leone's geological terrains. Soriba Samura reports.
The government of Sierra Leone has received international funding to carry out a comprehensive nationwide airborne geophysical survey under the Extractive Industries Technical Assistance Project, or ITAP-2 project. Giving an update, the project coordinator Mustafa Jibril said the project is meant to enhance geo-knowledge, which will attract investment and generate more revenue from the mining sector.
We have three major components within our project. One, we want to improve mineral sector governance, and then we want to enhance geological knowledge in support of the mining sector. But the one I actually want to talk on for the purpose of this press conference is one that deals with enhancing geological knowledge. We know that knowledge is power, and for the mineral sector, we want to be in a position to be able to bargain more positional strength with mining companies and investors.
He went on to say that government is in consultation with two firms, one South African and one Canadian, adding that one of them would fly the geophysical planes in the minerals-rich areas in January. Policy consultant of the Sierra Leone Minerals Agency, Daniel Bondo, pointed out that the move by the Ministry of Mines and Mineral Resources through the National Minerals Agency has potential to optimizing benefits the country gets from her minerals. He, however, highlighted the need for a review of the Mines and Minerals Act of 2009, which he says was enacted without a proper policy guide. Mr. Bondo informed the press that three policies, namely the Sierra Leone Minerals, Artisanal Mining and the Geodata policies, have all been approved by Cabinet and that they await to be launched by President Madabio. The geophysical survey, according to the Minister of Finance, Jacob Jusu-Safa, will link the mining sector to the rest of the world. Soriba Samura, SLBC News, Freetown.
Many thanks indeed to Soriba Samura for putting that report together. I'm afraid that's all we have time for in tonight's edition of News Hour on the SLBC. Now to end the news, a quick reminder of the top stories. As Parliament approves the 2019 budget, members of Parliament have advocated for increase in SLBC's budget. Female genital mutilation public campaign has intensified, and Marriage Stop Sierra Leone has introduced emergency family planning contraceptive. But that's all in this edition. On behalf of the rest of the team, my name is Mahawa Aliyu. For more about our programs, do send us your comments to slbc.sl. Thanks for watching the news, and good night.